I'm Lia Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello, you're watching Boomer Health at Home, the show where we aim to provide useful information to keep you happy and healthy at home. I'm Ryan Donald, your host, alongside my co-host Brett Pulte.
Hello. And
today we have a special show for you today. We're going to take a little behind the scenes, in-depth look of how the show gets put together. And our special guest is not only our medical coordinator for the show and consultant, but also a hometown girl and Dr. Lia Jamian. Lia, welcome to the show.
Thank you. Pleasure to be here.
So I kind of mentioned your hometown girl. Let's talk a little bit about that. Where'd you grow up?
Yeah, so I grew up right here in Bloomfield Hills, and I went to high school at Bloomfield Lasser.
Go Knights, yeah.
Yeah, that's right. And then Michigan State for college.
Go Green, or just go.
And I was in a program there, Lyman Briggs, which is a pre-med program, pre-nursing, pre-med. And then I went on to do medical school at Ross University School of Medicine. And then from there I went on to do my internal medicine residency training at Cleveland Clinic in Florida.
Oh, wow.
And then Nashville after that, at Vanderbilt for rheumatology.
You're well traveled too. You see, what's your favorite state so far?
I recently left Nashville, and I would say that was Tennessee was one of my favorites so far. Great place, Music City.
Yeah, very good.
Nashville is a really fun town. I've spent a lot of time there. It's one of my favorite cities to go to.
It is a lot of fun.
So with your special training in rheumatology, did you do your residency for rheumatology in Nashville, or?
Good question. So after medical school, medical school is 4 years, and after that you decide what you want to do your specialty in. So for example, if you do internal medicine, that's a 3-year residency program. Okay. So any specialists that go on after internal medicine have to do a 3-year internal medicine residency program. So that was actually at Cleveland Clinic in Florida. Then after that, you have to do a fellowship in rheumatology.
Gotcha.
So that was what was at Vanderbilt in Nashville. And that's 2-year fellowship program.
That's awesome.
So what was your experience like at the Cleveland Clinic in Florida?
It was wonderful. So, Cleveland Clinic, main site is in Ohio, and there's a couple satellites. Florida is the second largest, secondary to the Ohio site. Working in a tertiary care center like that is really a blessing because you get referrals, second opinions, third opinions. Right. So it's usually complicated cases, people that travel far, with stacks of records they bring with them in order to get an opinion, from one of the leading healthcare facilities in the world. So it was definitely a learning experience. It was enjoyable. There's people that were coming from South America, from the Caribbean. People travel far to go there. So,
wow. I'm sure that was really helpful having all the different doctors. Like you said, you can get 3 opinions on one visit.
Right, and a lot of times people would book their trips ahead of time and stay at a hotel nearby and stay for a week and go see their cardiologist, go see their rheumatologist, go see the pulmonologist, and do it all in 1 week, and then fly back home and then book another trip, 6 months later. So,
wow. Yeah, it's not. Florida's not just for Disney. I guess.
You said you've done a lot of schooling, but can you kind of add up for us how many extra years of schooling that you had to do to become a rheumatologist?
Yeah, so you do the 4 years of so after your 4 years of undergraduate training, you do 4 years of medical school, so that's 8 years, and then 3 years of residency. So that's another 3 years, so 11.
Wow.
And then 2 years of fellowship training, so 13 overall.
So what you're saying is you've been in school pretty much since the age you were 5, and doesn't look like it's ending anytime, huh?
That's right. So I joke around. I recently just graduated 25th grade. So.
25th grade. Yeah. Well, then there's continued education too. What are
That's
requirements
right.
in that to stay board certified?
Yeah. So continued medical education. It depends on which specialty, but for the most part, it's similar across the board in specialties in medicine. You take your board exams when you are finished with your fellowship training, and then you do those every 10 years. But it's not like you can breathe for 10 years.
Right.
There's what they call MOC credits. So every 2 years, and then every 5 years, you have to do a certain amount of medical knowledge exams and stay active and up to date in the field, which is extremely important, obviously, because things are changing all the time.
Oh, absolutely. Yeah, I mean, it's a science. That's why it's called practice. It's like you guys are learning at the time, and us as the patients, we appreciate all your hard work. So
you have to enjoy it, that's for sure, and you do. So
I'm sure. So, we've talked all about your schooling and everything, but can you describe the science behind rheumatology and, fighting autoimmune diseases?
Yeah, so rheumatology is really the study of the musculoskeletal system and how it pertains to autoimmunity. So people often get confused with the term autoimmune. What does that mean? Essentially, your immune system is your defense mechanism that your body holds. I think about it as the army that's constantly fighting. Typically, we think about it as when it's active. So if you have a cold, a virus, bacteria, your immune system is the target of what's going to fight that. Now, sometimes there's a balance, so that fight that your immune system is doing can be a little bit too strong, and that overactive or dysregulation of your immune system, and that's where autoimmune diseases come into play. So essentially, we don't like to use the word your immune system's attacking you, but often that is the example that we provide patients.
That's interesting. I mean, especially, I never thought about the immune system with it. Normally you hear rheumatology more associated with like arthritis and stuff. Why is that?
So, and it's a common, not misdemeanor, because it is true that it is associated with arthritis. Most autoimmune conditions that rheumatologists see and treat have involvement of the musculoskeletal system. Whether it's the joint, whether it's the cartilage, whether it's the bone, there is involvement of the musculoskeletal system, which causes arthritis, which is really inflammation within the joint.
Oh, okay.
Now, you just mentioned inflammation. Is that a culprit in a lot of the different autoimmune diseases?
It is. It definitely is. It's hard to say culprit versus propagator or really consequence of the autoimmune disease, but yes, inflammation is part of most autoimmune conditions, inflammation in the joint. Now with rheumatology, of course, you have non-inflammatory diseases too. So the most common, which is the most common arthritis worldwide, is osteoarthritis. And that's that wear and tear arthritis that we are all prone to get eventually.
Yeah. Sure. Well, what causes this inflammation?
So unfortunately, we don't know 100%, and that's what makes my field so interesting and exciting and challenging. But typically it's multifactorial. So especially with autoimmune diseases, you have some genetic predisposition to develop these conditions, whether it runs in the family or you have certain gene that's misplaced. But you have some genetic predisposition, but that in itself typically doesn't cause the disease. It's multifactorial, so different hits. So let's say you're predisposed to this and then you're a smoker, so environmental factors, smoking, or sunlight exposure, or a certain virus. It has to be the perfect combination of things in order to trigger the autoimmune disease. But we don't know for each disease what that trigger is, unfortunately. We have some ideas, but...
That's really interesting. And we talked about autoimmune diseases and arthritis, but what other diseases does a rheumatologist treat?
So I would say autoimmune is the most common, osteoarthritis, I'm sorry, is the most common, so that wear and tear arthritis. Yeah. Now, of course, that's mainly treated by primary care physicians, and then when it gets to a certain point for surgery, for hip replacement, knee replacement, the orthopedics take over. So rheumatology, we tend to treat and manage more autoimmune conditions. So conditions such as lupus, a lot of conditions that are rare that most people have never heard of, gout, Sjogren's syndrome, scleroderma or systemic sclerosis, vasculitis. These are all just fancy names for rare conditions. Not so rare for me because I see them every day, but...
And probably everyone back home is now Googling, like, what the heck?
Yes,
big words. Yeah.
Exactly.
Yeah. So I guess, I mean, and this is more my personal question as well, you hear autoimmune disease. What is an autoimmune disease?
So an autoimmune disease can be many, and it can span across many fields. So other examples of more common autoimmune diseases that people have heard about are IBD, irritable bowel disease, inflammatory bowel disease, which is Crohn's or ulcerative colitis. Multiple sclerosis is also an autoimmune disease. Okay. Probably the most common is thyroid disease. There are certain types of thyroid disease that are autoimmune. And then for us, the most common autoimmune condition in rheumatology would be rheumatoid arthritis.
Okay. That's, like you said, there's common ones, there's ones that we don't know about, but you see all the time. And you just said rheumatoid arthritis. Yes. So, what's one of the big things that happens with RA?
Great question. So, rheumatoid arthritis essentially is inflammation in your joints, typically the smaller joints, so fingers, hands, feet, knees, wrists, elbows, but essentially it can affect multiple joints. And it is, again, autoimmune, and we don't know exactly what causes it. But there are certain genes associated with it, and then the environmental factors that we know our risk factors are smoking, which induces the immune system in a way that regulates and triggers rheumatoid arthritis, as well as obesity is now more recently been associated with the development of rheumatoid arthritis.
So those are some preventative measures. If you're a smoker, if you're overweight, is there any other recommendations that you guys are seeing that may help with preventative measures?
So just in general, maintaining a healthy lifestyle for any autoimmune disease or any disease in general is going to be important. So maintaining a balanced diet, which we typically recommend the Mediterranean diet. People often ask about people often ask about, is there an anti-inflammatory diet? Well, an anti-inflammatory diet can mean different things to different people and different diseases. So I generally tell patients, unless they have another comorbidity where there's certain foods that they should avoid, just generally exercise 150 minutes at least a week of aerobic exercise, and maintaining a balanced diet, low fat, high protein, a lot of leafy greens. It's the best thing you can do.
I don't smoke, but 1 out of 3 is probably not good enough to prevent, right? That's all right.
So now, are autoimmune diseases extremely common with the general population? So
not so much. I mean, I would say, so for rheumatoid arthritis, let's say, it's about 1% is the prevalence of rheumatoid arthritis in the United States.
Okay. Just
to give an example. So the most common as far as rheumatology and your joints are concerned is that osteoarthritis that we can't really avoid, but rheumatoid arthritis is the most common, and it's 1%.
Okay.
And the others are way more rare. So.
Yeah. Now, we're talking about joints and stuff. I just read a study about a week or so ago that dispelled the old myth about popping your fingers in your joints causes arthritis. Is that study correct?
That is a myth.
That's put to bed.
That has been
Pop
put
your
to
knuckles
bed.
all you want.
Yes. Interestingly, just a fun fact, you brought that up. There was a rheumatologist scientist that wanted to study this theory. So he, on one hand, cracked his knuckle every single day for over 20 years from the time he was a rheumatologist. And then the other hand, he didn't. And he studied with ultrasound and different imaging modalities the difference in the joint structure, and there was no difference. So, and if you look at under an ultrasound, someone popping their joint, cracking their knuckles, you can actually see fluid. So it's really just water, fluid within the joint.
Wow.
That it's like a bubble, and yeah. So no, it is not harmful. Not that I would recommend it, but
right.
it does not cause arthritis.
Good.
Man, I'm thinking about all the relief I've missed out on now. But excellent. So you hear rheumatologists kind of described as the detectives in the medical field. Why is that?
So great question. So autoimmune conditions and rheumatologic conditions tend to be systemic, meaning they can involve multiple organ systems. They can involve your skin, they can involve your eyes, they can involve your joints, they can involve your heart, they can involve your gut, and on and on and on. So if sometimes aside from the joints, the other things might be involved first. So let's say the patient has problem in their eye, they see an eye doctor, they get treated, and then a couple months later it comes back. This leads to multiple doctor visits, multiple workups, and then all of a sudden they have a heart condition. And these can both be related to rheumatoid arthritis, for example, but the joint manifestations might not come till later. So often we are considered the detectives, which is why I love the field, because it's often challenging trying to put signs and symptoms together that at that point in time you might not have an answer to.
Interesting. It's almost like, did you ever watch the show House?
Yes.
Like a lot
I
like
love
that.
House. Yeah, that's right.
Yeah.
So now, being the detectives, you want a strong force, but is there a shortage of rheumatologists in the United States?
There are a shortage of rheumatologists, yes, especially with now this first baby boomer population who is retiring and nearing retirement. A lot of the practicing rheumatologists will no longer be practicing, so there's a huge gap. Interestingly, it used to be considered a male profession, and now there's more females than males, which autoimmune disease tend to occur more commonly in females.
Oh, really?
Yes. So there is a shortage, unfortunately, but I think it's promising that there's a lot of young rheumatologists and more rheumatology programs that are opening up.
Good job security for you, though.
That's right.
So now, I guess the question would be, you mentioned that rheumatologists get called in when they can't figure it out, but if someone's at home thinking, should I see a rheumatologist? The main question, I guess, is when should someone seek out a rheumatologist?
So there's multiple different reasons you would want to see a rheumatologist. Typically the primary, the first physician that the patient would see would be their primary care physician. And the primary care physician, when the patient's explaining their signs and symptoms, light bulb would usually go off. This is a little unusual. This isn't your run-of-the-mill wear and tear arthritis. And how do you know that? So we talked about inflammation a little bit. So the cardinal signs of inflammation going back 18 BC, rubor, calor, douleur, so a hot, swollen, red, painful joint is typically the joint manifestation. So not as much just pain, but actually swelling in the joint, warmth when you touch the joint, redness around the joint. Those are things that would prompt you to think this is more an inflammatory joint condition. And then, again, because multiple organ systems are involved, other things, unexplainable fevers, which is commonly seen in lupus or some of the vasculitises, skin rashes, eye conditions, sores in the mouth, sores in the nose. So multiple different things. As far as the elderly population, headaches are, if they don't go away, they're atypical, meaning the patient has had headaches their whole life, but this is a headache they've never experienced before. They're having fevers, they're having weight loss. We would be concerned about a condition called giant cell arteritis, which is more common in elderly. So it affects patients 60 and older for the most part. And it's inflammation within the blood vessels that can eventually lead to blindness. And if it's treated early, we can avoid the blindness that is irreversible. So I would say, as far as the elderly population is concerned, a severe headache, any changes in the vision would prompt a visit to the emergency room, and the patient would then be triaged from there. It's not a general population condition that people are aware of, but any physician, when they hear about a headache in an elderly patient, that is the first thing that they would think about.
And like you said, a lot of the signs to see a rheumatologist are persistent pain. So like myself, over 4th of July weekend, I was out with my friends, tossed the frisbee around a little bit, threw the football too much. I've got shoulder pain. I shouldn't really go see a rheumatologist because it's not, it's all just new.
That's right.
So if something like that persists, though, could it turn into something that a rheumatologist should look at?
So that's a good question. Eventually it could, but most primary cares would know when to send you to a rheumatologist. So anytime you have trauma or damage to a joint, that joint is more susceptible to develop other problems in the future. So for example, you injured your shoulder, you might have arthritis at an earlier age, not the autoimmune arthritis, that wear and tear arthritis because of the disruption in the mechanics of the joint, but nothing to worry about. Typically it's just injury related, and typically we use about, even before any imaging, about 6 weeks for injuries to resolve, minor injuries.
So this is great. I come to work and get free medical advice.
I know, this is right. So I guess, what does like the first visit to a rheumatologist's office look like? What should someone bring? What are they going to experience? And I guess go from there.
Yeah, so the most important thing is the history. So at least for us in some of these challenging, complicated conditions, we say that it's about 80%, in order to get the diagnosis, 80% history, 20% physical exam. 15% physical exam, 5% labs and imaging. So that might be surprising to some people. So having an organized medication list, surgical list, any conditions that run in the family, so having a family history, having all this information organized, I think would make the visit most efficient. Bringing a family member with you is always a good idea. Sometimes they might remember things that you might not remember as the patient. I always joke around with spouses, especially my male patients, bring their wives, because I know I'll get information from the wives that the men will withhold from me, as they tend to minimize their symptoms.
Yes, it's male denial sometimes. Yeah, we need to go. Just put some dirt on it. We're fine.
And that's pretty interesting too that you say bring a family member, because a lot of times people will start looking into family history and find weird things.
That's right.
But then they'll start talking to their family, and their grandmother knew about it, or their grandmother's sister knew about it, something like that. So if you have a family member with you, it's just gonna kind of help you find out what their issue is.
That's right, and it's always better for two sets of ears rather than one anyway, so.
Yeah. Well, absolutely. Well, thank you. That's actually all the time we have today. We want to thank you for coming on the show. Kind of, me and you, it's a very interesting field you're in, and thank you for everything you're doing, and also your assistance on our show as well. So that's what keeps us kind of in line with, otherwise we would just be making stuff up every day.
It was my pleasure. I enjoyed it. Thank you.
Thank you.
And if you at home have any questions for Dr. Jamian here, you can contact us. Either call us at area code 248-288-2270. And of course, you can also email us at boomerhealth@americaremedical.com. I want to thank you for watching, and we hope you have a great day. Stay happy and healthy.